Hello guys, welcome to this another interesting episode at Oh Mind Your Body, where we're going to talk about something that is very interesting, which is going to answer a lot of questions related to thyroid. So let me introduce myself. My name is Dwani Gala and I'm the founder and owner at Oh Mind Your Body, where we deliver fresh homemade salads and sushi across Mumbai and teach you all amazing people how to make some amazing sushi and some healthy foods. So today we have our very own dietitian Riya Doshi joining us and guiding us and giving us some information about what is thyroid and how to deal with thyroid and what foods you should eat in thyroid. So we're gonna have a look from Yellow Ball Riya Doshi, and let's get her on board quickly. And let me just see, how do I get that? Yeah, her with us quickly, and then we'll get started with our questions. So today guys, my internet is really giving me a lot of problems, so bear with me. Hi Ria,
Hey,
how are you?
I'm good. I'm good, thank you.
So
Yes,
let's get started quickly. What is the difference between hypothyroid and hyperthyroid, Ria?
yes, very common question, right? But they are completely different, I would say opposite. Okay, but there's one thing for sure that basically thyroid is a gland which is situated here at the throat. Okay, and malfunctioning of this thyroid gland causes thyroidism. Okay, now thyroidism may hypo hota hai and hyper. So hypothyroidism is basically underactive, okay, or slow active thyroid gland is called as hypo. Hypo means slow acting, and hyper means fast, overactive. Okay, so overactive thyroid is called as hyperthyroid, and the symptoms are basically, pretty opposite to each other. And because thyroid is one, I would say, organ which is responsible for a lot of hormonal balance in our body. Okay, it takes care of your mood, of your metabolism, of your heart rate, and many other things. Okay, so it affects majorly the entire body. So keeping to the mark is very, very important.
Great. So very well and crisp and nicely shared. So let's get to our next question, Ria. What are the symptoms of thyroid?
So the symptoms of thyroid, if I have to say hypothyroid, which is one of the most common. Okay, today when I see, 10, I would say 10 obese people, out of that, at least 8 of them have hypothyroidism. Okay, it's become so common. But what is really more alarming? So 40% of Indian women have hypothyroidism. But what is really more alarming is, today at the age of 8, 9 years old children also, they show symptoms of thyroid, which is really alarming. Okay, and what are the symptoms? The symptoms of hypothyroidism is, weight gain mainly. In women, there is a lot of weight gain, okay, sudden spurt of weight gain, obesity, fatigue. They feel tired all the time. Their depression, depression is one of the major cause, and people cannot relate depression with thyroidism, which is so important because they actually do not believe that thyroidism can cause depression, right? Another very major factor is irregular periods. People treat irregular periods, but they fail to treat the thyroid itself if detected. Okay, so hypothyroidism, gives you muscle cramps and aches and sudden weight gain. So these are few symptoms of hypothyroidism. Okay, now hyper. In this, you suddenly lose weight, and weight, people get very happy. "Acha hua, hyperthyroidism, losing weight." But honestly, it's not fat loss. It's protein. It's muscle loss, which gives you muscle ache, cramps. Your heart rate increases. You sweat a lot. So there's tachycardia, there is acidity. Okay, there's a lot of restlessness and anxiety which people actually encounter. There are skin changes, discoloration, patches, hair fall, brittle hair, brittle nails. So these are the kind of symptoms that one exhibits when one has hypo or hyperthyroid. Okay,
Very, very
and
well differentiated.
yeah, which is so important because gadbad ho jati hai. Nevertheless, they have to consult the doctor. But generally, this thyroid should, or rather, what I have seen is starts during the delivery of the second child or after the delivery of the second child. Okay, or in the mid 30s. But what we see today is really, really, there people exhibit the symptoms much earlier. Okay, so yeah. Hi, Rakhi.
Yeah, hi Rakhi. Hi Viral. Hi guys. Thank you for joining in. So let's go to our next question. What are the major causes of it according to you, Ria?
I can tell you one major cause, and that should be enough, I think, for everyone to understand. The major cause is the stress hormone cortisol. ओके छोटा मोटा स्ट्रेस नहीं आज मुझे एग्जाम का स्ट्रेस है आज मुझे सब्जी में क्या बनाऊं खाना क्या दैट इज नॉट स्ट्रेस ओके कंसिस्टेंट chronic long standing stress okay, gives rise to thyroidism, and that is why we see that these days people exhibit a lot of symptoms of thyroid much earlier in their age. Not only women, but it is also men who exhibit a lot of symptoms of thyroid because of this stress hormone, because वो तो सब में release होता है. Cortisol doesn't see this is a woman or is a man,
Right.
right? Men can divert, okay, but women are, more sensitive. They cannot really, lent it out, or they don't know how to express it much well, okay? Or see, men also, but because of the responsibilities, okay, so it gets a little lesser. But yes, definitely, because there is a lot of emotional or a lot of hormonal havoc in the body. Cortisol plays a very major role in maintaining your hormones, and that is why thyroid is an area of concern. So one is that, okay.
Mm.
Second, the cause of it is the lifestyle that we are leading today. Okay, the lifestyle wherein there are these processed refined fats, processed food and refined fats. Now what happens is the refined fats do not allow the cells to pass on information through the hormones and various parts of the body. जो मैसेज जाना चाहिए वो नहीं जाता. Okay, and that is the reason the normal function of the thyroid is affected. The normal uptake of the nutrients is affected. Third is less intake of iodine. As it is, our food has less intake of iodine. Okay, and iodine our body doesn't really, produce. So we have to depend on the outside source. But if you fail to have the iodine rich food, and mainly where it is in your salt. और अगर iodized salt नहीं लिया आपने, so you may end up having this issue. Okay, so and one of the major, selenium. Okay, selenium is something which is required, or which in thyroidism it is hampered. So these are some of the few causes, and so nutrients along with even genetic. Okay, there are thyroidism can be genetic, which I have seen. Okay, and vitamin A plays a major role in balancing your thyroid hormones. So there's much more to it. But yes, as I just said earlier, the major cause is your hormone cortisol.
Perfect. So what foods do you recommend, Ria, for one to manage their thyroid?
Okay, so first and the foremost thing is iodine rich food. And where is iodine present? Iodine is in iodized salt. So अगर आप हिमालय का rock salt लेते हैं, you don't have to take fortified iodine necessarily. You can take Himalaya ka iodine, iodized salt, rock salt. So in that the mineral is present. The second is include seaweed like kelp or spirulina in your food, which is a superfood rich in iodine.
Even
Okay.
norishi.
Oh yes, you will be able to tell. Yes, which is used in sushi, right? More?
Right. Right.
Okay. Okay. So yes, if you want to know more about it, you can always connect with Dhwani, because even I learned so much from her. All
I think
right.
even I
Then
learned from you. I think we both have a lot to share, and that's why we are here.
exactly. Another thing is it's very important to have a lot of protein when it comes to managing thyroid. Like in case if you have hyperthyroidism, when you lose muscle mass, it's very important that you focus not on putting on weight or having fatty foods, but having the right fats and the right amount of protein, or rather more than required amount of protein, because that will help you manage your thyroid. If you are looking to reversing it, then a lot can happen over it, where you have to replenish your body with minerals like selenium. Selenium is extremely important. Brazil nuts में मिलेगा, oats में मिलेगा selenium. Okay, your oil seeds, avocados, sunflower seeds, you will get selenium in all this. So regular use of nuts and oil seeds in your diet will really help you manage. Now, when it comes to eating vegetables, okay, people focus more on ये नहीं लेना, वो नहीं लेना, rather than focusing on क्या लेना है. ठीक है. So I'm sure people must be, even when you provide salads, Dhwani, they must be saying, right, कि अरे मुझे cauliflower allowed नहीं है, मुझे cabbage allowed नहीं है, I have thyroid.
Yeah.
Yes, all the cruciferous vegetables are not allowed. Okay, but if you are having those cruciferous vegetables saute करके या cook, steam or grill करके, okay, you are allowed. You can take it. Okay,
I think very
peanuts
great
and
myth that you busted today.
just it's a very simple thing. You cook your cabbage and cauliflower. Don't cover it with the lid. Let the gases just flow or vaporize in the steam, and that will help you to even have these vegetables, because cruciferous vegetables have certain compounds which will actually help you. So you can't completely avoid them. Okay. So also, when you're talking about these foods, also great need is there to focus on food such as calcium and vitamin D, because what we have seen is with thyroid patients, the uptake of vitamin D, calcium, and selenium is really very slow. So it's very important to focus on the intake of that. Yeah. So these are certain foods which
That's
will really.
amazing. So we have the next question is, do salads really help us in maintaining our thyroid?
Yes, it does. 100%. But as I just said that, in thyroidism, okay, other salads you can have kacha, but yes, this you have to really have it sauteed. So this needs to really be taken care. If, someone is having a sauteed broccoli or just a grilled cabbage or cauliflower, they can easily have it. So not an issue on that. But yes, definitely it will help, because there are so many multivitamins and minerals which will actually help you manage it very, very well. So you cannot avoid it. कि कच्चा खाना ही नहीं है. You can't avoid it.
Thank you for addressing that so clearly. I think, Ria, that's really helped a lot of people to clear a lot of myths related to
Yeah.
thyroid.
Also, Dhwani, when you put, I have seen your salads, you put a lot of oil seeds and your nuts, okay, that really enhances the nutritional value of it. Okay, so that's a very smart approach, in managing your thyroid and including the fats. And what I have seen that you put a lot of avocados too, which is a very good thing.
Yes. So let's get to our last question, Ria. Thank you for so much of acknowledgement. I'm really appreciating you a lot right now.
Anytime.
Let's go to our last question is, what are your 6 tips to manage thyroid?
Okay. So the first tip is that coriander seeds, if you have heard. The first thing is, if you really want to manage thyroid, you need to have something anti-inflammatory, and coriander is one of that. So coriander seeds आप ले सकते हो. You can hand pound it. Don't put it in the mixer. Hand pound it. या चकला बेलन लेके you can just pound it, and then boil it in the morning. Okay, you can store the pounded ones, boil it, make a concoction out of it in the morning, and छान के आप पी लो. Strain it and have it. This water in the morning, just 15-20 minutes before breakfast, really helps. Okay. Second thing is dry coconut. or that is lauric acid, or it has a lot of lauric acid which helps a lot of in the management of thyroid. If not dry coconut, you can actually consider having raw, cold pressed virgin coconut oil. 2 teaspoons of coconut oil. Just you can gulp it down. It has honestly an organic one, and the cold pressed one doesn't have that typical flavor of coconut. Okay, so you can actually have it. You can take this in the morning. That really helps and keeps your metabolism at the bay. Okay. Third thing is one needs to develop a healthy lifestyle. I mean, if you are thinking that by having just that one pill will help you manage your thyroid well, um, fine, it can manage your thyroid well. But if you really want to stop those medicines and start reversing the disease, then you need to make necessary lifestyle changes. Okay. And the fourth tip is go anti inflammatory. Okay, that is an anti-inflammatory diet where you go gluten-free, where you add certain herbs and spices, which reduces your inflammation because thyroidism is nothing but inflammation of your thyroid gland. So if you are able to manage that, I'm very sure, I have seen people reversing their thyroid and managing the reverse state. Okay, it's not bounce back. Okay, and sixth, and the very important, two, you cannot take sleep for granted if you are having thyroid. Okay, so sleep is the important factor when it comes to managing or curing your thyroid because सिर्फ दवाई से नहीं होगा, sleep is important. Okay, your gland requires that stress, your body requires that stress, that rest. And the last thing, if you think you can manage thyroid just by exercise or lifestyle change, no. Meditation becomes as important as brushing your teeth when it comes to managing thyroidism. So, yes, one has to meditate, learn to meditate, and manage stress. As if you are able to manage or control the hormone cortisol, you will see a massive change in it. So these are my tips when it comes to managing thyroid.
And I think if they really want to get into more details about what to eat, they can join our 21-day challenge and experience what it is like to do a consultation with you. And then if they really like, they can go ahead because it's not a 21-day thing, you know. It will take a couple of weeks to get done with thyroid and then to maintain it. So I'm sure if people are really
Yes,
keen, they can enroll for a 21-day program, which is starting tomorrow. A
yes,
second program, a
definitely.
second group.
Yes, there are many people, like-minded people who are really enjoying and doing fabulously well. Trust me, they've surprised me, okay, in their exercise, with their food, and with their performance. And if you really want to have that experience, you can join it. Today is the last day for enrollment as our batch has started from tomorrow.
Yeah. So great, Shreya. I think very, very crisp and nicely mentioned about thyroid. And I think this will give a lot of clarity to people who are looking to get at least some clarity on how to go about with thyroid. So thank you so much.
Thank you, Dhwani, and I will see you next week, same time with yet another disease.
Yes, and we'll talk about it in much more detail. Thank
Yes.
you.
Thank you for having me. Bye bye.
Thank you
Have
for
a
being
great day.
there. Bye. Yes. So that's it, guys. That's it for today. Signing off, Dwani Gala, founder and owner at Oh Mind Your Body, where we deliver fresh homemade salads and sushi across Mumbai and teach you all amazing people how to make some amazing sushi and some amazing